The hidden risks to heart function in a dehydrated body, cardiovascular health beyond myths, hydration, salt, cholesterol, diet, movement, and modern stress. The functioning of the heart in a dry body environment. When we talk about heart disease today, we immediately think of high blood pressure, cholesterol, diabetes, blocked arteries, and lifelong medications. Despite all this knowledge and treatment, cardiovascular disease continues to rise. This raises an important question. Are we missing something more basic than cholesterol and medicines? The cardiovascular system is, at its core, a fluid-based system. The heart does not pump in isolation. It pumps blood, and blood is largely water. For circulation to remain smooth, blood must be sufficiently fluid, blood volume must be adequate, and stress hormones must be under control. In modern life, especially after the age of 40-50, many people live in a state of chronic, unrecognized dehydration. Thirst sensation reduces. Water intake drops unknowingly. Salt is restricted out of fear. Physical movement decreases. Stress levels remain high. The result is thicker blood, poor circulation, increased heart workload, unstable blood pressure, and rising cholesterol, often treated as separate problems. This talk looks at the heart in its real environment, a frequently dry internal world, and explains how hydration, salt balance, movement, diet, metabolism, stress, and lifestyle together determine how well the heart functions. Before blaming the heart, cholesterol, or salt, we must first ask a simpler and more fundamental question. Is the internal environment fit for circulation? The cardiovascular system, simple physiology. The CVS has three basic components. 1. Heart, a muscular pump and electrical organ. 2. Blood, a fluid medium. 3. Blood vessels, dynamic, living tubes. For the heart to function well, blood must be fluid. Volume must be adequate. Vessels must be relaxed. Stress hormones must be controlled. All of this depends on hydration, electrolytes, movement, and metabolic balance. Chronic dehydration, the silent starting point. After 40-50 years, thirst sensation reduces, water intake falls unknowingly. Salt is restricted out of fear. Physical activity reduces. This leads to chronic low-grade dehydration. Dehydration causes reduced plasma volume, thick, viscous blood, poor circulation, increased heart workload. The heart works harder not because it is weak, but because the blood is difficult to pump. Blood pressure, why it rises in dehydration. Contrary to popular belief, dehydration does not always lower BP. Chronic dehydration often raises BP. Why? Low blood volume activates RAS. Stress hormones constrict vessels. Sodium is aggressively conserved. Vascular tone increases. This is stress-driven hypertension, not salt-driven hypertension. Many BP problems are actually compensatory responses to dehydration. Salt, from enemy to essential electrolyte. Salt is not a poison. Salt is a circulatory stabilizer. Adequate natural salt. Maintains blood volume. Reduces stress hormone activation. Improves circulation. Reduces heart workload. Stabilizes BP variability. Low salt plus low water. Keeps the body in alarm mode. Worsens BP control. Increases palpitations, fatigue, anxiety. Salt raises BP mainly when water is inadequate or kidneys are compromised. Natural salt versus refined salt. Refined table salt, highly processed, stripped of minerals, contains additives. Natural salts provide trace minerals, improve electrolyte balance, better support hydration. Important clarification. Iodized salt, iodine, is absorbed and has public health value. But refined salt is a poor electrolyte. Salt is for circulation. Iodine is for thyroid. They should be addressed separately. Natural iodine should come from food or appropriate supplementation when needed. Cholesterol, protector, not primary enemy. Cholesterol is essential for cell membrane integrity, hormone synthesis, brain function, vascular repair. Chronic dehydration causes hemoconcentration, cholesterol appears higher, vascular stress and microinjury, inflammation and oxidation. The body may increase cholesterol production as a protective response, like a biological bandage. Cholesterol often rises because vessels are stressed, not to cause damage. Statins. Value, limits, and responsible use. Statins reduce cholesterol synthesis, save lives in high-risk patients, but they do not improve blood viscosity, correct dehydration, reduce stress hormones, restore circulation. Statins affect mitochondrial energy, CoQ10, muscle function, gut microbiome, blood sugar regulation. Therefore, patients must be assessed properly. Hydration must be corrected. Counseling about side effects is essential. Statins work best in a hydrated, metabolically balanced body. Dietary cholesterol and eggs. Fear must be cleared. Dietary cholesterol has minimal effect on blood cholesterol in most people. Liver self-regulates cholesterol production. Egg yolk is nutrient-dense, supports brain, hormones, muscles, does not raise cholesterol in most individuals. The real culprits are sugar, refined carbohydrates, ultra-processed foods, chronic dehydration, insulin resistance. Cholesterol is not the enemy, inflammation is. Sugar spikes and insulin resistance, the real CVS drivers. Repeated sugar spikes cause endothelial damage, oxidative stress, inflammation. Insulin resistance raises triglycerides, lowers HDL, creates small dense LDL, increases BP variability, thickens blood. This explains heart disease with normal cholesterol, poor response to medicines. Artificial sweeteners trigger insulin response, worsen insulin resistance, alter gut microbiome, increase cardiovascular risk signals. They are not metabolically neutral and often undermine hydration and metabolic health. Diet and nutrition for CVS, simplified. Cardiovascular diet is not about restriction, but environment correction. Whole foods over processed foods, vegetables and fruits for antioxidants and fiber, adequate protein for muscle and circulation. Natural fats over refined oils. Reduce sugar and refined carbs. Hydrate properly with meals. Diet works only when combined with movement and hydration. Movement and exercise. The second heart movement acts as a peripheral pump, improves venous return, reduces heart workload, improves BP control, improves insulin sensitivity. After 50, gentle daily movement is essential. Consistency matters more than intensity. Sunlight, nature, stress, and modern life. Sunlight improves BP, insulin sensitivity, circadian rhythm. Nature exposure lowers cortisol, improves heart rate variability. Grounding may reduce stress and autonomic imbalance. Stress unifies all CVS risk factors. Mobile phones close to the chest should be avoided as a precaution in sensitive individuals. The heart responds to lifestyle, environment, and stress, not just diet and drugs. Final integrated message. Cardiovascular disease is rarely caused by one factor. It is the result of dehydration, electrolyte imbalance, insulin resistance, chronic stress, sedentary lifestyle, processed food environment.
Conclusion: restoring the environment in which the heart can function. The heart rarely fails because it is weak. More often, it struggles because it is forced to work in an unfavorable internal environment. Chronic dehydration, electrolyte imbalance, insulin resistance, physical inactivity, constant stress, and processed diets together create a state where blood becomes thick and sluggish, circulation becomes inefficient, stress hormones remain elevated, blood pressure fluctuates, Cholesterol rises as a protective response. Medicines work only partially. Hydration, when understood correctly, is not a simple lifestyle tip. It is a foundational physiological requirement for healthy circulation, adequate water intake, appropriate natural salt, regular movement, whole foods, sunlight, stress regulation, and metabolic balance do not replace modern cardiology. They make cardiology work better. Before suppressing cholesterol, before fearing salt, and before adding more medicines, we must first restore the basic conditions under which the heart evolved to function. Fluid blood, stable circulation, balanced hormones, a calm nervous system. The most important message is this: the heart functions best not in a dry world, but in a well-hydrated, well-balanced internal environment. Restoring that environment is not alternative medicine, it is fundamental medicine. Final line: modern heart disease is not a failure of medicine, it is a failure of fundamentals. Holistic Wellness Foundation, Imphal, healing beyond boundaries.